third muscle, we're going to look at the rhomboids, attachment from the spine to the scapula. And again, two sides to the rhomboid story, but most of you will find that in the realm of working with a rhomboid, you're looking to contract it, shorten it, and that will be anything where you're attempting to bring the scapula together, rowing movements, lifting movements, straight spine, and trying to get the stable scapula. Now, again, in movement, there is no such thing as a stable scapula, and hopefully there's no such thing as a stable spine. So what is the rhomboid's role in that space? The rhomboid itself is kind of on an oblique axis like this, so definitely attaching to the medial border of the scapula coming from the spine. So again, I think we break it down in each plane so that you can have a good chance to look at it. But before we do that, I'm just going to show you the influence of the spine on the scapula, two structures that are not attached to each other at all, other than by the tissue that surrounds it. So if I take just going to place my hand on Chris's spine of scapula and just have him flex his spine, watch the journey that my hands take in that moment. And then as these extends his spine back, keep going. Can you see how my hands come back together? So just to describe that for you, we can break the scapula down into 3 dimensions. And this is actually what we might describe as an anterior tilt of the scapula, but you've also watched it journey upwards, so we can also describe it as an elevation of the scapula. Whereas when coupled with the spinal extension, what we're hoping to see is a depression of the scapula and also a kind of posterior tilt, because the rib cage is posterior tilting backwards as well underneath the head. Again, the scapula will, when we move into the frontal plane, will abduct away and will also adduct towards. Again, that is a movement, 3-dimensional movement in relation purely to flexion and extension of the spine. And the final here is that we get some retraction as he extends and some protraction as he flexes. So single-dimensional movement of the spine, flexion extension, creates a 3-dimensional reaction in the scapula. And then therefore any tissues in between, the tissues are not influencing this. This is a choice Chris is making in his head to flex and to extend. So as he flexes the rhomboid here, you can see a flexion of the spine is coupled with that elevation, abduction and protraction of that shoulder. So that is putting length in 3 dimensions onto the rhomboid. The shortening action then is the opposite. So as he extends his spine, the muscle will shorten in order to depress, adduct and retract the scapula. So that's without even looking at the spine in 2 planes. We've got a 3-dimensional load. So if there's any place that you can get your clients with struggling rhomboids is to get them flexing their spine and mobilizing their scapulas in a healthy way, then we're going to find better usage and movement of that muscle. Having seen that when we flex and extend the spine, we get a 3-dimensional movement of the scapula, I think that's probably the most important part that you could begin to consider. But we'll look at the other movements of the spine, because as we know, the spine is moving through all 3 dimensions both ways throughout the whole gait cycle and through healthy movements. If I bring in the frontal plane of the spine, I'll get Chris to just flex towards me. We can see that the humerus actually adducts closer to the body and the humerus on this side abducts away from the body. And that abduction away will bring the scapula with it. So if I stand him up, you should be able to see that that scapula just glides a little bit away. So we end up creating some length in the left side rhomboid and some shortening in the right side rhomboid. So what that means is that here, this left side rhomboid is decelerating, acting against the movement away of the scapula to minimize the movement of the scapula and help him to contract back. Again, if I just stay in that place, stay in the frontal plane, if I stay in that place and just internally rotate his humerus here, then we also see a further movement away from the spine in protraction and elevation of the scapula on the left. When we add in the humerus, we get a bigger stretch. So we need to consider more than just the spine. In the rotational plane, if he does a clean rotation to the right, what should happen is we should see a retraction of the right shoulder and a protraction of the left shoulder. So you can feel that in your own body. But again, that retraction brings the scapula back towards the spine, so shortening rhomboids on the right-hand side and lengthening rhomboids on the left-hand side. So there's a lot of movements here to consider. And we also have especially as we like to fix things and move things, if I fix his scapula here and ask him to rotate away again, then I completely change that dynamic. So now I'm shortening on the left with a right rotation of the spine as opposed to before when it was lengthening. But this time if I get him to rotate towards me, I can get a really nice stretch in the rhomboid. So it all comes down to whether I want to get a stretch in the rhomboid functionally and relative to the human movement, or if I just want to get a stretch in the rhomboid, and then I can choose the 3 dimensions in which I'm going to move it. Now, putting all 3 together, you're going to get your biggest bang for your buck in a flexed spine and movements that drive the scapula away for you to get no option but to contract for the rhomboids. So if you've made it this far, understanding that we're looking at the scapula and we're looking at the spine and the relationships between the two. If you think back to the abdominals video, we talked about the relationship that the pelvis has with the spine a little bit. Now, I don't need to move the scapula or the spine. If I just move his pelvis, let's say we rotate his pelvis to the right. By rotating his pelvis to the right and keeping his spine still, I've actually turned his spine to the left. And if I've rotated his spine to the left, then I must have created a shortening through the rhomboids on the left here and a lengthening through the rhomboids on the right here. So this is just a small indicator that movement down below will drive up into muscle tension changes upstairs. So we live in an environment where we're stabilizing, shortening muscles, trying to work in a balanced environment. But are you working someone's rhomboid and their pelvis is rested in a rotated position? Then are you working rhomboids equally on both sides? No, you're not. Let's look at it with a lateral tilt in place. So drop his pelvis here. I'm actually, by dropping his pelvis on the left, creating a right lateral flexion here in his spine. And again, that creates that small adduction here, abduction here, lengthening the tissues on the right-hand side and shortening the tissues on the left. So again, imagine your client rocks up, rotated through the pelvis to the right and hiked a little bit through on the left, and that's their postural stance, and they actually have pain on the right side rhomboid here. That is pain that comes from a persistent, overloaded length-tension relationship in the rhomboid relative to the rest of the structure. Don't massage it, don't rub it, don't try and stabilize it or shorten it. Get the pelvis and the spine and the scapula to do what they're designed to do, and because joints act and muscles react, the muscle will follow suit, relax, and feel much better.